Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement.
Thank you all for joining us today on another episode of the Granite List Live. Today, I am thrilled to be joined by Kevin Leigh. He is CEO and founder of MindClub America. Kevin, thanks so much for joining me today on the Granite List Live.
Thank you, Leigh. It's great to be with you.
Yeah, so you've got quite a history of creating companies, especially in the mental health space. I believe this is your fifth or sixth company that you have founded. And tell me why now? Why MindClub of America? What makes them different?
Yeah, this is my fifth behavioral health startup. After college, I went to work at Ernst & Young, EY now, and we had some healthcare clients. And one of the most interesting companies that I got engaged with was a psychiatric hospital company, and I joined that company at a very young age. It was a startup company developing psychiatric hospitals and clinics. And I got really attached to that work. Although I'm not a clinician, I was fascinated by the work we were doing in the psychiatric hospital and clinic space. And just a little more background on that, as a youngster and all, I was playing sports and all, and I was really always interested in what motivated one person versus another. Why would some folks get disgusted, frustrated? Just the mental aspects of the game, or games as it was. So that company was sold 22 months after I joined it. And the founder and a couple of other guys and I started a outpatient clinics company. And so being young and bold and in a lot of ways foolish, but I was bold. I decided I'm going to start my own company. So I did at 27 years old and developed some outpatient clinics that just by luck, it seemed, were smashingly successful. But the reason they were so successful is that every patient who came through our door, we treated as a precious opportunity because we wanted just to survive. We were in very competitive marketplaces. And one of them, by the way, is Memphis. So we had success by just focusing on every patient being a precious opportunity, like I'm saying. And we communicated with our referral sources really well to build relationships. So all that we did then became the foundation, if you will, of what I've done since then. So that company did really well. And then I got into psychiatric hospital management business and decided after years to start some psychiatric hospitals. And that was my third startup company. We started psych units within hospitals, like a large psychiatric hospital unit in Baptist Hospital in Knoxville, and on and on. And as time marched on, other investors wanted those companies more than I did. So we sold them. Now to where we are with MindClub America. After all these years of doing that work, I, like so many other people in healthcare, decided, we're pretty good at treating sick people, but we've got it backwards. And so it's not novel to say that we're in a sick care system. Why don't we do more to help folks stay healthy, get out in front of anyone getting sick? And we say that often in my club. That's what we do. So it's not a novel idea or thought to say, let's change from a sick care to a preventive system, but people are not doing that. So how do we do that? So the MindClub concept is centered on helping people stay healthy. And we do it through providing folks free, very brief, confidential assessments. They're evidence-based assessments, and then getting those folks to stay engaged with us routinely. We know that routine engagement drives outcomes. And the centerpiece of our model is my mental fitness plan. So every person, whether you've got anxiety, depression, or you're rocking along, you're happy, you're stable, and you're not fighting the demons, if you will, at all. I believe, and our team in MindClub believes, that everyone ought to have a mental fitness plan, just like you might have a physical fitness plan. And then the next part to it, in summing up our model, like I say, we start with routine assessments. We help people who need help very quickly. We help folks to stay engaged with us. We use educational materials, and we gamify so you can earn badges. We gamify the process. My mental fitness plan is a centerpiece for every person, and we integrate with primary care, which is critical. There is no mental fitness or mental health without physical health, and there certainly is not good physical health without mental health.
So there's really a triangle: mental health, physical health. There, you said a third one, I thought. Or is it just the two?
No, just the two. We integrate them, and you could call it a triangle because you've got a healthy person when you integrate those two parts.
Right. There's a couple things that I want to go back and dig a little deeper on. One, let's go ahead and define what is mental fitness and having a mental fitness plan. I understand, I can go to the gym every day and have a physical fitness plan, but what does a mental fitness plan look like?
Yeah, I love your question, Leigh. A mental fitness plan includes, the way we look at it in MindClub, includes a toolkit that you use. It's an emotional wellness toolkit. We believe that every person should have tools to manage their mental health. And I can say that maybe best by way of example. For example, cognitive behavioral therapy has been proven to be effective for 30 years. And if a person learns skills in cognitive behavioral therapy, it's labeled therapy, but I'd rather call it cognitive behavioral toolkit. But it's cognitive behavioral therapy. And if a person learns the skills you can gain through CBT, you can deal with adverse events, mental health challenges, whatever may happen in your life, or if you happen to be a person who struggles with anxiety from time to time, you'll know how to deal with that in the moment a lot better than if you did not have the CBT skills. So a person can learn through MindClub's platform for free. We offer it for free. Anybody out there in the world can see it by watching a series of videos. You'll learn your cognitive behavioral therapy skills. And like I say, that provides you an emotional wellness toolkit for life. We have many programs like the CBT program, our Habits Change program, a depression management service where you learn self-compassion, love yourself, help yourself, and other e-learning programs we have. We even have a nutritional program because a lot of people who know what they're talking about will call our gut our second brain. So we've got some videos and educational materials that are very helpful. And it's all, I believe, entertaining and engaging and helpful for folks.
So our gut is our second brain.
Yeah. That's what I understand. Yes.
Okay.
Yeah.
Well, I mean, and we had a prior conversation where you mentioned that you see a big overlap, and you just mentioned it before, that a healthy person has good mental health and they have good physical health. And that I think is it 50% of those that are chronically depressed have a cardiovascular issue going on as well.
That's right. Yeah. Biggest indicator for long-running cardiac problems is clinical depression. They go hand in hand. So folks who have chronic depression have 2 times chance, if you will, of having cardiac problems. Okay.
And so I want to go back and dig into the second piece of your model where you say that you have DPCs in play. And is there a relationship between your therapists and your direct care that you provide as well?
Yes. We integrate with primary care providers. We love the direct primary care model. We love it. And why? Because it's based on preventive medicine. We want to emulate that model as much as we can in our mental health services. And so in integrating, Leigh, to address that, it's all about communications, focusing on assessments, evaluations. A person gets an evaluation through MindClub. We want that evaluation subject to HIPAA regulations. We want to be able to provide the primary care provider who's attached to that person with that information, so that the primary care provider knows that if a person is clinically depressed, to help that person be encouraged to conduct healthy activities every day to stay healthy. It's simple, common sense integration. The reasons we like direct primary care so much is that it's a preventive model. People are encouraged to see their primary care provider twice a year. MindClub's approach, very similar. We want people to get evaluations, assessments of their mental health. Whatever their mental health needs may be, we work to help them get out in front of getting sick. We don't like people going to emergency departments, psychiatric hospitals, and residential addiction treatment. Those are big spend items. Many of them can be eliminated, don't need to happen. And we can do that if we're providing outpatient mental health services customized for a person with whatever mental health condition they may have.
Yeah, very interesting. And you mentioned too, so you're a mental health provider. You've got the doctors within your ecosystem, but you're not an EAP.
Right.
Educate me on what the difference is, because it seems so similar, but why are you not an EAP?
It is very similar. An employee assistance program typically is focused on mental health issues. And then secondly, for a consumer out there, financial management issues. Typically, that's the bulk of what employee assistance programs do. We just don't want the label of being an EAP because they're not successful. They do not work. In general, the engagement rates are around 3% of a covered health plan population. We know that the demand for mental health services is in excess of 20% or more than 1 out of 5 adults on any given day, and many adolescents, obviously, have a mental health problem, a challenge that should be addressed. Well, EAPs are just not getting it done. So we don't like the label.
I like that. And you brought up how your engagement rate is so much higher than an EAP. So what creative ways are y'all doing to get people engaged and keep that existing engagement?
Yes, we have an awareness campaign that we execute with every employer with whom we work. And that awareness campaign involves educational material, very engaging material that's dribbled out to the employers' covered lives, their employees and family members, so they see our MindClub brand, they understand what we do, and we try to, well, as I said earlier, we want everyone to take a brief assessment. It takes 4 or 5 minutes. That's the key tool in this, is to get them going. We identify folks, if they're honest and answer these questions, there's no reason for them not to be honest. We'll identify the great majority of the folks who can benefit from mental health counseling or medicines management. So we identify them that way. But again, we do it through that awareness campaign, and we customize an awareness campaign for every employer with which we work. And we make it super easy for the employer. They just push buttons. The human resources person is just pushing buttons to email our materials out. When we engage with a new employer, we're sending out once a week information for 4 to 6 weeks, and then every other week. And then after 3 months or so, it's once a month, depending on what the employer wants to do.
Okay. No, that's super interesting. So once you receive the assessments and someone is in need of a therapist or need to be engaged in your program, do you do outreach appropriately to make sure that they know to the services that exist?
Yes, we do. So let's say you answer the brief assessment, takes you 4 or 5 minutes, 21, 26 questions, depending. You will immediately, and that's confidential, once you push submit, we have a person on the MindClub team, a trained person. They don't need to be a therapist, but a coach, if you will. Contact the person and say, here's your results. It looks like you could benefit from an evaluation with a therapist. Can we do that? And if you say yes, generally you're going to see a therapist within 2 days.
Wow, that's great. And one more piece of your program that we haven't touched on is these communities that you offer to your employer groups. Can you speak a little bit more about those?
Yes. We know as humans we thrive when we are engaged. Engaged being a key word. When we are engaged with like-minded people. So if I have an interest in a subject and I can engage with other folks in an online community and discuss our challenges, problem solve together, if you will, that can be very engaging. And it doesn't have to be, we know that if we're in a community, it can be a yoga community. There's a very successful online yoga community started by a lady in Texas, and it's a big hit. She's got like 200,000 people, by the way. Yeah. But for example, our online communities involve our parent inner circle, which is for parents who have struggling teenagers or young adults. They struggle with drug use or anxiety or depression or both. And we help those parents learn to communicate with their child and be a hero to their child and be a problem solver. And it helps the parents as well, because 90+% of parents with a teenager or young adult worry about the health of their child. That has a direct impact on the productivity of that adult while at work. So we've got a solution. We have another inner circle, which is for folks who have eating disorders. That's a very tough disease. 9% of us will have an eating disorder in our lifetime that needs to be addressed. 26% of those folks will attempt suicide. It's a silent killer. So we've got an online community for those folks and other online communities that are supportive, educational, where people go to get help and emotional support so they stay healthy. All these services, Leigh, are provided for free if you're connected with an employer. We do not charge an employer any base fee like an EAP does. We don't do that. We're making our living, if you will. We earn our revenues through mental health counseling, therapy sessions, and medicines management.
Yeah, well, thank you for sharing that. And if I want to access those communities, I'm only able to do so if my employer has engaged MindClub America as a provider within my health plan. Is that correct? I can't be an individual necessarily.
Now, some of the communities you can't access without having an employer connected to you. You can go to our online forum, if you will, the online community for parents, like I mentioned. That's free of charge. We may change that and firewall that, if you will, on down the road. For right now, though, as we're building it, we've got over 1,000 parents in it now. We just started, so it's a big interest. And like I say, there's tens of millions of parents who have a struggling teenager or young adult. So we open the door to those folks. It's a branding opportunity for us while we're trying to help people.
Well, and what a great opportunity for a free resource that these employers could bring and market to their employee base, to help with recruitment and retention. And like you said, those that are engaged with like-minded people, they thrive, and they thrive in their personal life, and they thrive at work as well. So that's just a great resource that you guys are offering. Let me ask you a question while I've got you. We've got about 5 years of data on remote workforces and kind of the push from work from home. And talking about the communities, I'm sitting in a room at home, with the door shut, and there's actually not even a window in here. So I can imagine how people are isolated being at home. And so, are these communities helping? Are you seeing any data?
Yeah.
Or, not even just the communities. What are you seeing in the mental health space of what's happening with isolation?
Yeah, it's really interesting that it took a pandemic to make happen what should have already anyway. I know several therapists, licensed clinical social workers typically, who have patients they've never seen except online, and they're doing very well. So our ability to connect with people and have them in individual or group sessions, like in community support meetings online, has proven to do really well. We're just getting positive feedback all the time that our platform is very helpful to people. I hope I'm answering you, Leigh, with that.
Yeah.
We're getting constant feedback, and it's because people come to us. For example, we've got a Managing My Stress online support meeting every Monday. You can attend it. For now, it's for free. But that online support community where people can just go, check in, and attend a supportive meeting for 40 or 50 minutes has proven to be of great value to people.
Right.
So, yeah, we're getting a lot of positive feedback.
That's great. I know you've helped so many people that need help. Do you have one or two success stories that you're willing to share on the impact that you're making, especially in the employer space, because that's where the majority of our listeners are? I know you're saving significant dollars by getting people engaged in mental health and seeing that on the health plan too, because that does overlap. Is there something you want to share?
Yeah, in my prior company, we started a company providing mental health services with an emphasis on addiction treatment. And we were stunned that after just 18 months or 20 months or so of operations, that Ford Motor Company was sending us people in large numbers because we were working to help folks stay on the job. And that was a big deal. We got outcomes. We communicated so well. We stayed connected with people. We did got a similar result with the veterans from Memphis and in the Panhandle of Florida, active military as well as veterans, by just focusing on them, addressing their mental health needs. But as far as success stories, I could tell you hundreds of them. We've had the unfortunate situations with folks who had addiction as well as depression so often. They may have been addicted to alcohol as well as painkillers. And even though someone's child, or in one case that sticks out of mind, a grandchild, overdosed and died, unfortunately it does happen, but that the thank yous that we received on our team from just helping those folks have a better quality of life for some period of time is amazing. That folks who, like I say, had a struggling child, and that child may be 28 years old, we helped them for a while, but then they relapse, which happens so often. We want to minimize the relapses, and we did a great job of that. We reduced the relapse rates and kept people healthy as well as anybody could. 90+% of the folks that we were treating, we stayed connected with them, and over 70% of them were healthy a year later, which is remarkable in the mental health space. Great success stories for all of that.
Mm-hmm. It's a hard place to be. I'm sure the stories you hear can be heartbreaking, but those that you're really able to make an impact with and improve their quality of life and see the light at the end of the tunnel really is amazing. So I bet it's rewarding.
It is rewarding. It's I can't think of a better space to work in than what we're doing in mental health.
Well, Kevin, I certainly appreciate the time that you've shared with us today. If anybody wants to get in touch with you or MindClub America and talk about opportunities for their organization, where should we tell them to go?
If you go to our website, mindclubamerica.com, there's a contact us place. That's the best way, mindclubamerica.com.
Well, excellent. And take advantage of those free communities while they last as well. So
that's right.
All right. Well, Kevin, thanks again for joining us, and for everybody else for listening to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.